The clinical information pertinent to this patient is as follows. MRI imaging shows that the right TMJ disc is medially displaced. This was on the coronal images. He was diagnosed with Tourette's at 7 years of age. Prior to 7, he was diagnosed with attention deficit hyperactive disorder and obsessive compulsive disorder. These are medical diagnoses by his pediatrician and family physician. He has left temporal headaches 2 to 3 times per month, which are so severe that it forces him to go to bed for relief. Examination showed bilateral TMJ clicking upon opening the mouth. He bruxed his teeth. He has a constant barking sound, which decreases when I repositioned his mandible edge to edge at a height of 2 tongue blades. He also suffers from bilateral tinnitus, which is a humming sound. He has left and right face pain, worse on the right than the left. It's painful for him to chew food. He has left and right neck pains, left and right stiff necks, cervical crepitus upon movement of his head left and right shoulder pain. When I palpated around his head and his neck, he elicited a painful reaction in 38 different anatomical areas. Okay, this is Justin, who has come into our office, and as you can see that he's a Tourette's patient, and we're going to begin his treatment today with fitting him with a lower mouthpiece to stop all these uncontrollable motions that he has. And we're going to videotape these motions for a minute or two, just so the viewing audience can appreciate what he has to go through. Justin is a 17-year-old young man who began suffering from these things at the age of 8 years of age, and it's about time that he got rid of them, and this is what we're going to do for him today. Okay, I've just finished working on the appliance, and we're going to put it in for the very first time right now on this young gentleman. Did that hurt you?
No, it's checking.
How's that feel now?
Weird.
Does it feel even? Or does one side feel a little higher than the other?
Feels pretty even.
I am inserting the lower mouthpiece at what I think is the correct vertical height. This is the most critical element in the delivery process. As you will see, this is not the correct vertical for this patient because we subsequently modified it by adding to this height the thickness of 1, then 2, and then 3 wooden tongue blades. And with each addition, the patient reported that his symptoms and urges improved. We then added additional acrylic to take into account this additional height of these 3 tongue blades to the original height of the appliance. And you will see the response of the patient to this height. Chop, chop.
Really?
Tell me what's happening to you.
Well, what?
Does the urges seem less?
I guess. It's not really, I don't really shut my mouth. It's
Yeah, I don't want you to shut your mouth.
like close my, jaw.
Open.
Now, are we just seeing if my chicks come?
That's what?
If my chicks are coming down? Is that what we're doing here?
Yeah, just see if it's calming them down more.
It is.
With this in there?
Yeah. It's just a little bit.
Does that help you? The tongue blade help you? Seem to be helping you?
You put that's a lot better. Right there. Two of them. Or two more.
Okay. Try 3. Tell me if 3 is better than 2.
Two and three. I mean, they're both
Okay.
the same.
Take it in. Mix me up some stuff. I have added some additional acrylic here,
Thank you.
the amount being the thickness of those 3 additional tongue blades. Now I'm going to let the acrylic harden and trim it to the thickness of those 3 tongue blades. Can you tell that's higher?
Yeah.
How's it feel?
A lot better. It's a big difference.
Quiet you right down, isn't it?
Yeah. Just a little bit. My ticks are just like way much more calmed down.
Yeah. Let's give him a new appliance. He had broken the clasps off his original appliance, which decreased his stability. His symptoms did not return. He has been wearing an appliance for a total of 5 months, and we are showing you this video footage to show that his corrections and improvements are long-lasting. He will tell you that his symptoms started to diminish within a week of the original appliance's insertion, and they have been gone for the last 5 months and stayed gone. In his history, he also had 5 years of constant everyday occipital headaches, which are headaches in the back of his head, every single day for 5 years prior to coming to see me, and he hasn't had any of those at all since the insertion of this appliance. He's going to say something to the viewing audience, and now just tell him what you how you're coming along.
I am doing fantastic since I've got this appliance in.
It has, my ticks have completely diminished. Even after I have my appliance out, my ticks are still not there for hours and hours after I have my appliance in. I haven't really tried to go days, but I've had them out for a couple hours.
He's had a total of, he estimates of 20 ticks.
Yes.
He got this appliance over the summer, and the children in his previous grade school knew about his ticks, so he went and registered in a brand new high school, and they are totally unaware that he is a Tourette's patient. He's got them all fooled.
Yep.
And he started to make relationships with girls now, and got them fooled too.
Trying to.
Good for you. Anyway, he's going to continue wearing this, and it's very, in my opinion, it's very easy to treat these Tourette's patients, at least teenage boys and girls. They're much more easy to treat or respond a lot quicker than Tourette's patients in their 40s and 50s. Those are the ones that seems to be more resistant to treatment and takes longer to treatment and takes greater skills to treat. It's much easier to treat these youngsters.
Justin is doing so much better. He hardly notices, his tics, and he started at a new school, and they haven't even noticed that he has Tourette's. And when we first went in to talk to him, we told him how bad it was, and they can't believe it, because he doesn't tick at all, hardly. I mean, it's an amazing difference.
Has he brought home a young girlfriend yet?
Not yet, but we're working on it.
Oh, okay. Well, that'll probably be the next step. Okay. This patient returns after 2 months since his last appointment. We haven't adjusted his appliance yet. He tells us it's worn down a little bit, and his ticks are starting to creep back in a little bit, and so we're going to adjust his appliance, check it completely out, restore it completely, and then send him on his way. Another telltale sign is how deep his bite is. Most of these patients with the appliance in will have an open bite when their symptoms are gone. And this patient has worn down the appliance, so his teeth are overlapping them a lot. An overlap like this might be good in a normal patient, but is not good in a Tourette's patient. We want an increased vertical dimension. We have just finished adjusting and rebuilding this patient's appliance. We have increased its height. Remember when he bit down, his teeth overlapped about 30 or 40%. Now when he bites down, he is open about 3 or 4 millimeters. This represents about a 6 or 7 millimeter increase in height on his appliance. Do not be afraid of going into an open bite scenario when you build these patients' appliances. They need all the occlusal support you can give them to support these joints here, or decompress these joints and take the pressure off the auriculotemporal nerves and its branches. We built his appliance up vertically, increasing its vertical height today. Zoom in. Right. So he goes from about the level of where my thumb is to this amount of opening right here. This is a considerable increase. He feels it benefits him. It decreases his urges and his tics.
Yeah, significantly.
You want to tell the audience how you've been in the last 6 months?
Good, yeah. I mean, it has worn down probably the past 3 months or so. It's a lot. And you can tell my tics they come back. But they aren't as bad as they used to be, even with it worn down. But it feels good.
Okay. Okay, and you feel we're helping you out?
Yeah.
Okay, good. Okay, it's been 3 months since you've been in here. How have you been doing?
Great.
Good.
Yeah,
No
great.
problems?
No?
Okay, we're going to build your appliance up today. Okay. And in fact, it's already built up and it's hardening up, and I'm going to polish it up and fit it to you. And we'll have it ready for you in about 5 minutes. Okay?
Okay.
This patient returns after 2 months since his last appointment. We haven't adjusted his appliance yet. He tells us it's worn down a little bit and his ticks are starting to creep back in a little bit, and so we're going to adjust his appliance, check it completely out, restore it completely, and then send him on his way. And that's what this appointment will consist of. Wait. Coming from the front. Another telltale sign is how deep his bite is. Most of these patients with the appliance in will have an open bite when their symptoms are gone. And this patient has worn down the appliance, so his teeth are overlapping them a lot. An overlap like this might be good in a normal patient, but is not good in a Tourette's patient. We want an increased vertical dimension. We have just finished adjusting and rebuilding this patient's appliance. Bite. We have increased its height. Remember when he bit down, his teeth overlapped about 30 or 40%. Now when he bites down, he is open about 3 or 4 millimeters. This represents about a 6 or 7 millimeter increase in height on his appliance. Do not be afraid of going into an open bite scenario when you build these patients' appliances. They need all the occlusal support you can give them to support these joints here, or decompress these joints and take the pressure off the auriculotemporal nerves and its branches. Turns for a treatment checkup. It's been several months since we've last seen him, and his appliance had worn down, and his ticks had started to creep on back, and we have rebuilt the appliance at this appointment. And he's going to tell the viewing audience how he's been coming along in the past several months.
Okay. It's been progressing fairly well. It's still, when it wears down, my ticks come back slowly, but it's far better than what it was before I even had the appliance. My ticks are 80 to 90% gone. I still have some, but it's not as near as it was.
And you're off all medications, right?
Yeah, for this.
Okay, good.